Hey everyone, now that the mask mandate, strict lockdowns, the business closures, and the other efforts to slow the spread of COVID have started to ease up a little bit or come to an end altogether, a lot of people are wondering if Social Security offices are going to open back up as well. So in today's video, I want to help you understand where the administration stands currently on their policy for getting in-person help at one of their local offices. But before we get there, if you're new to this channel, be sure to subscribe and hit that notification bell. There's so much going on with Social Security right now, and as new developments come out, I'm going to be right here breaking them down so you can get every dollar in benefits that you deserve. So on March 17th, 2020, the Social Security Administration closed all of their offices to the public for in-person services. Now, for those who are accustomed to receiving face-to-face service to address issues or questions about their benefits, this has been a massive shift in how they interact with a federal agency. Now most people have to use the online services at ssa.gov or call the 1-800 number. And this has started to get frustrating for a lot of people who just can't seem to get the answers and help they need over the phone or on the website. Sometimes there's just no substitute for sitting down with a technician at your local office and having them explain your benefit payments. So in the comments of this channel, I'm starting to hear a lot of people ask the question, when will offices reopen? But I want to tell you, I'm starting to think that it may be time to reframe the question and instead ask, will Social Security offices ever open again? And how do we need to plan for that? Now, I'm going to dive into that in just a little bit, but for now, as of May 2021, offices are still closed for most of us. But there are a few limited cases where you may be able to schedule a one-on-one meeting at your local Social Security office. These meetings are by appointment only, and appointments are only granted in critical circumstances. Here's a list of the scenarios where the SSA will grant an in-person meeting. If you are without food or shelter, including utilities, and need to apply for or reinstate benefits. You are without medical care or coverage and need to apply for or reinstate benefits. You currently receive benefits and have an urgent need for payment to meet expenses for food, shelter, or medical treatment, and you cannot receive the payment electronically. You are age 12 or older and applying for your first Social Security card. You need to update or correct your Social Security information, such as name, date of birth, or citizenship, to obtain income or medical care or coverage, or other services or benefits, for example, filing a tax return, applying for housing, or seeking an economic impact payment. If your situation falls outside of these circumstances, you'll have to conduct your business online or over the phone. Thankfully, this doesn't need to be as tedious as it may seem, and it is possible to receive good service even if Social Security offices aren't open for in-person meetings. Over the past several years, the administration has worked really hard to expand the services they offer online. You can now apply for retirement, disability, and Medicare benefits online. You can check the status of an application or an appeal. You can print a benefit verification letter and a whole lot more. Now, I'll have to admit that I'm a little bit mixed on this approach. On one hand, I see the need and importance of in-person services. As I've said before, sometimes there's no substitute for getting one-on-one help. But on the other hand, the office closure has forced a lot of people to dig in and learn more about how Social Security works and how the rules apply to them. So in a way, this has been a blessing in disguise. Now there are more people familiar with the website and how to navigate the sections that are pertinent to their situation and not just accepting what they are told by a Social Security Administration employee, which may or may not be correct. That being said, I do think that reopening Social Security office as soon as possible needs to be a priority. While services are available online, that doesn't help much unless you have a good computer with a strong internet connection. This presents a major challenge to the hundreds of thousands of individuals who may lack access to a computer, internet connection, or don't have a reliable phone number or mailing address. You can see this issue with the decrease in Social Security benefit applications. Since the closure of offices, newly awarded SSI applications are down 30%. So it's possible that the office closures is having a disproportionate effect on the most vulnerable populations, those with low income and disabilities, as evidenced by the decrease in SSI applications. So unfortunately, The real answer to when will Social Security offices open again? It may be never, at least not in the way it was before. A permanent closing of these offices could be the eventual outcome, even as the pandemic fades into the rearview mirror. This could become even more likely if one of the big Social Security employees unions gets their way. This proposal that they've suggested, it comes from the National Council of Social Security Administration Field Operations Locals. Now, they represent more than 29,000 Social Security employees, which means that they represent half of the SSA employees. But perhaps more importantly, they're an affiliate of the American Federation of Government Employees. This union covers 700,000 government workers, which gives them a loud, powerful voice. When they speak, a lot of politicians pay close attention. This union sent a letter to the Commissioner of the Social Security Administration and made their request very clear. Teleworking should be the agency standard, with all casework that can be handled virtually required to be handled via telephone and internet, part of the letter stated. It then continued, following the IRS model, a single field office should be open in every congressional district for necessary in-person meetings, trainings, etc. Now, right now, there are 435 congressional districts. If there was only one field office for each district, the Social Security Administration would need to permanently close more than 2/3 of their offices. But if the administration truly mirrored the IRS's model for field offices, you'd only have about 300 locations left open. So needless to say, that is going to be a big shift in how the administration delivers their service to the American public. So now I'd like to hear from you. Do you think closing most of the Social Security offices is a good idea? Bad idea? I'd like to hear your thoughts either way down in the comments below. Hey, don't leave without downloading my Social Security cheat sheet. It's completely free and it's packed with information that I've distilled from thousands of government website pages. With the offices being closed, you need every resource you can get your hands on, and this one will help you tremendously. There's a link down in the description where you can get your download instantly. Thank you so much for watching.